It's exactly 12 minutes past 7. Good morning with breakfast from BBC News. Let's return to our top story now because the Prime Minister is expected to announce his roadmap out of lockdown for England tomorrow, with ministers meeting today to discuss those plans.
With weeks of speculation and scientists warning against lifting restrictions too quickly, what is the sensible course of action? We're joined now by epidemiologist Dr. Deepti Gurdasani and Lancashire's Director of Public Health, Dr. Sakthi Karunanithi. Good morning to you both. Dr. Gurdasani, if I could come to you first, let's start with the latest news about the acceleration of the vaccination programme. That is surely a great thing.
Yes, absolutely. It's a really, really good thing, but I think it needs to be part of a longer term and a multi-pronged strategy to get on top of COVID. We haven't had this so far, and now the stakes are even higher because 1 year into the pandemic, our systems are still at breaking point, and we now have to contend with new variants that are more transmissible and potentially more fatal. We have vaccines now, which is great, but we still need to roll them out to the majority of the population. And we don't know how effective they're going to be against the most recent concerning new variants that are fortunately not dominant yet. So I think we still need to take a very cautious and multifaceted approach to this.
Dr. Sakthi, let me bring you in at this point because we know, of course, that there is a lot of optimism about this vaccine rollout. But what does it tell us about the speed of the restrictions being lifted in terms of what needs to happen first? What are you looking for in these figures to be confident that restrictions can indeed be lifted?
Yes, and it is great news that vaccines are being rolled out faster. I think as a nation, we are facing this classic pandemic trilemma, needing to keep the COVID levels down, but also restoring public services and recovering the economy. And it is very visible to the naked eye that there is a huge variation between areas across the country. And also the epidemic is shifting to working age population, which largely speaking haven't been vaccinated yet. So we must be very, very careful in not repeating the same mistakes that we did in the summer and during the Christmas time. And each step will have to be carefully evaluated before further restrictions are lifted.
Yeah, and you mentioned there the different levels of infection and higher rates amongst different parts of the population. Just explain where you are seeing spikes and where the rates aren't perhaps coming down as quickly as many would like.
I mean, if you just look at the national picture from the southwest, the rates are in the region of 90 per 100,000, whereas in the West Midlands and the northwest it is 175. And the same pattern repeats if you look at the older population as well. So what we really need is a specific policy to protect communities that are affected more faster as the lockdown is looking to be lifted.
Dr. Gurdasani, I'd be interested to know your take on that because the government has focused so heavily on the vaccine, haven't they? And the success of the vaccine being the way out of lockdown. Is there actually, though, a more complex picture that we should be looking at?
Absolutely. I think focusing on vaccines as the only way out of this is actually really short-sighted and dangerous. I think what we really need to see from this plan is a multifaceted approach. So it has to be based on absolute case numbers and R rates. So we ease lockdown gradually based on our case numbers rather than arbitrary timelines and vaccine rollout. We also need mitigatory measures in schools very urgently. We need to fix our test, trace and isolate system so that once cases come down, we can keep them low, which is where we failed before. And very importantly, we need to support people with isolation to make all these systems work and comprehensive border controls with managed quarantine. We need to do all this because we need to control the pandemic while we're rolling out vaccination. If we don't do that, the pandemic goes out of control again. And more cases will mean more people in hospital, more people in ICUs, many more deaths among people who haven't been vaccinated yet, more people living with long COVID, and much greater risk that new variants will emerge that will threaten our vaccine effectiveness.
We know that schools are one of the first places that will open up as we come out of lockdown. And you mentioned there urgent support needed in schools. What support do you think is needed?
I think we need to bring our policy very much in line with aerosol evidence and CDC guidance and what other European countries are doing. So we need masking, both in primary and secondary schools. We need much more attention to ventilation, air filtration, air purification devices, carbon dioxide monitors. We need to reduce our bubble sizes. Currently, there's no cap on bubble sizes. We have bubbles as large as 300. Reduce class sizes, which means much more support for recruitment of teachers and staff, use of empty spaces to allow the sort of physical distancing that we need.
Dr. Sakthi, you talk there about different levels of infection amongst different areas of the country, but also in different demographics, particularly amongst working age people, for example, or those who cannot work from home. Now, it seems the government is quite keen to avoid a regional approach with regional tiers and regional lockdowns, and instead the whole country facing these restrictions together. Do you think that's a wise move?
I think so. I think we are in it together as a nation. And perhaps as a nation, we need to be patient for every area's levels to come down much further. And these are areas where, like you said, people couldn't or weren't able to work from home. Generally, poorer areas where the infections are higher, we have evidence to suggest that in these areas, people weren't able to work from home. And I think the national approach is the right approach. We are in it together. Perhaps we need to be a bit more patient and get the basics right, like Deepti was saying before, about test and trace, vaccination program, border control, as well as looking at the evidence on an ongoing basis and carefully putting mitigation measures in place.
And the Prime Minister has said that he's very keen to make sure this third lockdown is the last lockdown. Of course, so much of that depends on the rollout of the vaccine, the continued success, but also new variants. Are you confident we won't have to face another lockdown?
I mean, it is very clear whenever we have lifted lockdowns in the past, there is a surge in the number of cases. We have brought the infections levels very low, particularly in the older people where there's also vaccination. So regardless of that, when we lift the restrictions, the cases are going to go up. I think we can be reasonably confident if we are careful in lifting the lockdowns and putting mitigation measures in place, particularly areas where it's more affected in the past, to avoid a further lockdown. But it very much depends on what also happens with the virus and how we all play our part in it, in being able to maintain hands, face and space guidance. And these are all the infection control mechanisms that we as a community, as a society, will need to be living with a longer period of time before we can be very sure that there isn't going to be another lockdown.
Dr. Sakthi, in your area, you are, of course, Director for Public Health in Lancashire. What is the situation with where you're up to with vaccination at the moment in regards to these new, shorter deadlines that we have coming in?
We're doing very well, thanks to our NHS colleagues, as well as our wider public sector partners and volunteers. We are in the top 10 in terms of the percentage of people that have actually got the vaccines in the top 4 categories. But of course, what is important is in areas like Lancashire and in many parts of the country as well, where there are similar demographics, the proportion of people that are in the lower age groups and the lower categories with long-term conditions are much higher. That is why we need the pace of the vaccination program to match with the priorities and the needs in each of the communities and not just a one-size-fits-all approach. And that's what we need so that we can level up and be protected to the same level, especially if the lockdown is going to be lifted fairly sooner, because we still have lots of areas in the north and many parts of the other country where the levels of infections are higher compared to other areas.
And just a final word from Dr. Deepti. The government quite clear that it wants to encourage people to be able to meet again. Mental health also figuring in this unlocking and this roadmap out of lockdown. How important are other factors, aside from just the vaccine rollout, in making sure people are able to resume some sort of normality?
I think it is very important, and I think it needs to be sort of balanced with not raising infection rates. So I think a sort of meeting of people outdoors in a socially distanced way with masks, is something that might be feasible without increasing infection rates. But the moment we allow people to mix in crowded environments, outdoors or indoors, or particularly in crowded settings indoors, without those safety measures in place, I think we're putting everyone at risk.
Dr. Deepti Gurdasani and Dr. Sakthi Karunanithi, thank you both.